Chief Nursing Officer for England's Shared Governance Collective Leadership Programme is made up of 3 components: shared decision making, nursing midwifery excellence and local accreditation. And I'm delighted to be here today with colleagues from across the country who are sharing their local accreditation programmes with us. Today's brilliant because we're bringing together some really experienced nurse leaders to talk about their programmes, how they brought them together, the value that they bring to patients and those that we care for, and really exciting the enthusiasm and passion that their staff have for this work as well. We all know what nurses and midwives bring to the table and the fantastic work that they do, but sometimes we really have to articulate it and demonstrate it and show it to others as well. So really delighted that these colleagues are able to do that today and share that learning.
Local accreditation to us is a way of assuring the quality of our services. It brings both clinicians, service users, carers together so that they can comment on the quality of our services.
It provides an environment that everybody can contribute towards, and it puts patients at the very heart of why we come to work and delivering the care that patients expect.
It also provides the organisation with an opportunity to understand how each of those wards and departments are adhering or achieving alongside those standards. So not only do the wards know what they're supposed to do, but the organisation as a whole understands how those wards are doing, so they get a local intelligence.
It's one of those approaches that is not a harsh regulatory approach. It's more clinically led, and everybody has bought into the value of it. So it's kind of become part of the DNA of the organisation.
It's benefited practice because it's standardised care delivery, not only in Salford but across the Pennine sites as well. And it gives a framework for staff to follow to ensure that they know the expectations of the organisation.
We've also been able to rate our wards, and by that we've been able to provide feedback to those wards against the standards. That then allows those wards and those leaders to modify, to change and to improve practice, but also share that good practice with other teams across the organisation.
Key to our success has been the engagement of ward managers and the teams really embracing the whole process and engaging in the standards and feeling really proud about the process. So they are really elated when they get a pass and they achieve all of the outcomes from ward accreditation.
The biggest thing we have seen is the reduction in harm. So we've identified through the use of safety thermometer that harms caused in hospital, for example falls, pressure tissue damage, have reduced significantly, and now our organisation is now below the national average. For us that's been a big change in understanding and knowing that we're providing safe, harm-free care to our patients.
What today's taught me is that actually we have a lot of those building blocks in place, and I was particularly interested in the work that Lincolnshire have done, where they've taken Salford's approach and they've applied it to their values, their approach, and have been really, really clear about don't bite off more than you can chew. You know, make it achievable, make it smart, and make it work. And that way you'll engage all your teams, and it's something that will become part of their bread and butter and something that they'll aspire to deliver.
I think the key points from today is really to engage with the team that are going to be implementing this at sort of ward level, but also at management level, that the team, the corporate team you have behind it really need to be a driving force in terms of sustainability. We've learnt the hard way in the past that without enough people to really drive that, then it can't be sustained. But also really to get the wards engaged with it so that they take ownership, they feel pride in when they do achieve things, and they reflect if things aren't quite right and there's some room for improvement.
We've got lots of staffing engagement sessions, but it will be passed on through leadership development courses that we're doing at the moment with the Band 6s and Band 7s. I think this is going to massively help engage nursing staff. It'll help them have one voice in terms of speaking about patient care. It'll give the frontline nurses a real voice to share their opinions about how they can forge new working relationships with other members of the team.
What this really is all about is consistency.
Teamwork.
Empowering.
Accreditation is about improvement. That's what it's all about.
We know if this work is implemented, the value that it brings through improved experience, improved outcomes and the delivery of care. And also when you have staff that are engaged, that feel empowered and that are really happy in the place they're working for, we know the impact that makes on their patients. And through this work, we think it's one of the ways that we can really achieve this as well.